Vanakkam, good morning. In this video, we are going to discuss about the acid-base balance. The body pH, the pH of the blood and extracellular pH is around 7.4. If the pH is less than 6.8 or more than 8 produces the death. If the pH is less than 7.4 is called as the acidosis. More than 7.4 is called as the alkalosis. Small changes in pH can produce major disturbances. Most enzyme functions only with narrow pH ranges. Acid-base balance can also affect electrolytes. Electrolyte imbalance is common in acid-base imbalance. The pH changes can also affect the hormonal secretions. Body produces more acid than bases. The food intake ingests the acid. Acid also produced from the lipid and protein metabolisms. Cellular metabolism produces the carbon dioxide. Carbon dioxide is react with the water form the carbonic acid. So carbonic acid then dissociated from the hydrogen ion and bicarbonate ion. Bicarbonate vapor is the most important chemical vapor. It reacts immediately within the seconds for the acid base imbalance. Sodium bicarbonate and carbonic acid normal ratio is 20:1. 20:1. So this is maintained for the normal acid base balance. Acid base balance. So hydrochloric acid, sodium bicarbonate react form the carbonic acids and sodium chloride. So this is the maintain the balance, acid base balance. Bicarbonate vapor is the important chemical vapor, reacts immediately. Another important chemical vapor is the phosphate vapor. This is the major intracellular vapor. It neutralizes the hydrogen ion. H2PO phosphate is combined with the hydrogen ion form the H2PO4. The major chemical vapor is the protein vapor. The protein vapor, hemoglobin is act as the protein vapor. It work in the blood and interstitial fluid. Carboxyl group of the hemoglobin gives the hydrogen ions and amino group receives the hydrogen ions. Side chain that can offer hydrogen ion are present at the 27 amino acids. So hemoglobin is act as the important chemical vapor. Chemical vapor act immediately, react within the seconds. The acid-base balance, the respiratory mechanisms is important. The exhalation of the carbon dioxide. So the exhalation of the carbon dioxide is the acid. Acid is evaporated in the form of carbon dioxide. It is powerful, but only work with the volatile acids, not work with the lactic acids. So fixed acid is not evaporated. Volatile acid is carbonic acid is converted to the carbon dioxide. It is expelled through the air. Carbon dioxide is react with the water, form the carbonic acids. Body pH can be adjusted by changing the rate and depth of breathing. So more CO2 is accumulated in the body during the hypoventilation, it produces the acidosis. More CO2 is expelled outside means it produces the alkalosis. The respiratory regulation is act within the minutes to hours. But the kidney regulation of the acid-base balance, it takes hours to days. Kidneys play the important role for the acid-base balance. It can eliminate the large amount of the acids and it can also excrete the base and can conserve produces the bicarbonate ions. Most effective regulator of the pH, can regulate long time. Kidney fails, pH balances fail, not able to maintain the acid base balance. Rate of correction of the acid base balance. The chemical buffer acts immediately, it acts within the seconds. Respiratory mechanisms takes minutes to hours. Renal mechanism takes hours to several days. If the pH is less than 7.35 is acidosis. The pH is more than 7.45 is alkalosis. The body responds to the acid base imbalance is called compensation. Maybe complete, it brought back within the normal limits, that is complete compensation. Sometimes difficult to come back to the normal level, that is called as the partial compensation. The main problem is metabolic means the hyperventilation or hypoventilation can help the acid base balance return to the normal level, that is called as the respiratory compensation. If the problem is respiratory, main problem is respiratory means the renal mechanism try to brought back to the normal level, that is called as the metabolic compensation. Main principal effect of acidosis is the depression of the central nervous system through decreases the synaptic transmission, produces a generalized weakness, deranged central nervous system function, the greatest threat will be there. Severe acidosis causes disorientation, coma and death. Alkalosis causes over-excitability of the central and the peripheral nervous system, numbness, lightheadedness. It can cause nervousness, muscle spasm or tetany, convulsions, loss of consciousness and death. The respiratory acidosis, main problem is the respiration. The blood level of the carbon dioxide is increases more than 45 millimeter mercury, that produces the more carbonic acids. So hypercapnia increases the carbon dioxide level, high level of carbon dioxide in blood. It is mainly due to the depression of the respiratory center in the brain that control the breathing rate, and some drugs, head injury, paralysis of the respiratory muscles, emphysema, this produces the respiratory acidosis. Acute conditions like adult respiratory distress syndrome, pulmonary edema, pneumothorax also produces a respiratory acidosis. They cannot eliminate the carbon dioxide, so carbon dioxide is accumulated. Compensation for the respiratory acidosis is the kidney eliminate the hydrogen ion and retain the bicarbonate ion. Signs and symptoms of respiratory acidosis: breathlessness, restlessness, lethargy, disorientation, tremor, convulsions, coma, respiratory rate fast then gradually depressed, skin warm and flushed due to the vasodilation caused by the excess carbon dioxide. Treatment of the respiratory acidosis are restore ventilation, inject the IV lactate solutions. The lactate is converted to the bicarbonate in the liver. Treat underlying dysfunction or diseases. That is very important for the respiratory acidosis. The respiratory alkalosis, carbon dioxide level is decreases due to the hyperventilation, mainly due to the hyperventilation. So carbonic acid level is decreases. This is the most common acid base imbalance, respiratory alkalosis. It is due to the hyperventilation. Respiratory alkalosis seen in the high altitude due to the high oxygen deficiency. The hyperventilation will occur. That will decreases the CO2 level. That produces the alkalosis. Pulmonary diseases, congestive heart failure, acute anxiety, fever, anemia, early salicylate intoxication, cirrhosis, gram-negative sepsis. These are the other causes of the respiratory alkalosis. Compensation for the respiratory alkalosis is the kidney conserve the hydrogen ion, excrete the more bicarbonate ion. Treatment for the respiratory alkalosis is treat the underlying cause and breathe into the paper bag IV chloride containing solution. That the chloride contained solution, chloride replace the bicarbonate ion. So it will correct the acid-base balance. Respiratory alkalosis. The metabolic acidosis, bicarbonate level is decreases below the 22 milliequivalent per liter. Most common causes loss of bicarbonate through diarrhea and renal dysfunction, accumulation of the acid like lactic acid, ketones, failure of the kidney to excrete the hydrogen ions. Symptoms of metabolic acidosis are headache, lethargy, nausea, vomiting, diarrhea, coma, and death. Compensation for the metabolic acidosis increases the ventilation. Carbon dioxide is expelled outside. The renal excretion of the hydrogen ion if possible. Potassium is exchanged with the excess hydrogen ion in the extracellular fluid. So hydrogen ion is going into the cell, potassium is moved outside the cells. That is also favor for the maintaining the acid-base balance. Treatment for the metabolic acidosis is the lactate solution. The lactate solution is converted to the bicarbonate in the liver. That is treat the metabolic acidosis. The metabolic alkalosis, bicarbonate level is increases more than 26 milliequivalent per liter. Most common causes excess vomiting, loss of more acids, excessive use of alkaline drugs, certain diuretics, endocrine disorder, heavy ingestion of the antacids, severe dehydration produces the metabolic alkalosis. Metabolic alkalosis most commonly occur with the renal dysfunction, so cannot count on the kidney, very difficult to manage. And respiratory compensation also difficult. Hypoventilation limited by the hypoxia. Hypoventilation is limited by the hypoxia, and so mainly kidney can excrete the more bicarbonate and retain the hydrogen ions. Symptoms of metabolic alkalosis are respiration slow, shallow, hyperactive reflexes like tetany, often related to the depletion of the electrolytes, atrial tachycardia, and dysarrhythmia. Treatment of metabolic alkalosis, electrolyte to replace the loss, IV chloride containing solutions. Chloride is replaced by the bicarbonate. Treat underlying disorder. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbook. Thank you once again.